forward.
There and there.
Okay, so just let me know if you can't hear. Okay, so people have asked me about what to know for the test as far as your drugs. The main thing that I want you to focus on is the classifications, to know what your different classifications do. That's the main thing, okay? And we're going to focus a little bit more on medications in just a few minutes with an activity that we're going to do. Let's talk about some psychosocial assessments that we would do with these patients. What are some psychosocial issues that you think would come up with these patients? Some things you might need to be aware of. Depression, isolation. What about their support system? Do they have one? Do they not have one? Do they have one that knows what's wrong with them?
What about denial?
Denial. Okay. Do they have somebody to help them with their ADLs? Maybe, maybe not. What do we need to do? We need to put them in touch with the right people to be able to get those services if they need them. What about employment? Depending on where they are in their disease process, they may be able to work and they may not be able to work. So, do they have family that can contribute to their income? A lot of those things we don't know. What did they do? Were they somebody that did manual labor who would not be able to return to their current position? Or was it somebody maybe that had an executive position that possibly could return to their position? So all of those things are the drug use. Do they have a history of drug use? Are they still using drugs? What can we do to help them? We can't make them do anything, but you can certainly offer them the resources. It's up to them whether they choose to take advantage of it. Okay? So what about suicidal thoughts? Do we want to assess these people for suicidal thoughts? Mm-hmm. Yeah, exactly, we do. They may have a lot of anxiety related to a new diagnosis of this. They may be very moody. Some of the medications may affect their moods. So those are things that we need to keep in mind. And a lot of times, when they may be in denial whenever they first are diagnosed, and then it kind of starts to sink in that this is real and it's not going away. So they may have some anger. How would you manage that in the clinical setting? If you had a patient that was displaying anger because of a recent diagnosis and nobody wanted to take care of them,
Give them a chance to talk about it.
they might jump off.
Right.
That would be
Give them a chance to express how they feel. Like, don't judge them. Just kind of, it's like I work on the neighborhood. So, like, when you have patients like that, like, sometimes you don't need to say anything. Just allow them to express themselves. Clearly, safely. I mean, you don't want them to be violent, but allow them to express themselves and how they feel.
Okay. What about your staff? How would you handle your staff if you had a patient that was very difficult, and this will happen in the real world, that they're very difficult and nobody wants to take care of them?
Or you would tell them to take care of their
Can you talk a little louder?
Tell them that the patient's kind of angry and tell them to take some care.
Oh, they know it. Everybody on the unit knows it. Everybody. And they're saying, oh, please don't assign me that patient today. I do not want to take care of Mr. Jones again today. I've had him for 2 days. We have to share the love.
I think you need to give your employees a respite from that. You need to share the load.
Yeah.
Would be a big.
So that might be a possibility.
Or if like the nurse that took care of them previously knows tips or like advice to give them that maybe calm the patient down and spread the word, maybe how it helps the patient.
Good report.
And maybe it's right. There again, it goes back to report. So I think that it's very difficult to put yourself in a non-judgmental situation in situations like that, because if the patient's lashing out at everybody, you have to stop and question. Is it really something we're doing? Does he really have a valid complaint? Did he have to wait 45 minutes on his pain medication last night? I mean, is he upset about that? I mean, that's a valid complaint, isn't it? Or is it just that the whole world is irritating him. Everything is irritating him. Anybody that walks in the room is irritating him. So those are some things that we probably are going to have to work through with the patient and with our staff. And sometimes you just, you have to tell the patient, listen, we are trying to do the best we can at taking care of you. You have to be kind to our staff. So, and sometimes you just have to be very blunt with them and tell them that, this isn't okay. Especially if they're screaming and throwing things. So, it's like, this isn't socially acceptable. Like whenever you're trying to bring your children to behave, you take them out in public. It's like,
treat others the way you would treat.
That's right. But they're not in that place at that time. So we have to be very mindful about that. What about their cognitive ability? How are we going to manage issues with that?
Give them activities.
Maybe. What if they don't want any activities to do?
Interact with them on their cognitive level.
Okay.
Speak short, simple sentences.
Right. Those are things you'll have to assess your patient for to see where they are. And
Open-ended questions.
when we start learning about doing more on teaching plans, that's a really big thing that you have to meet the patient where they are. You have to know what their educational level is. Whether they have a 6th grade education, whether they have a college degree, does that mean they know everything about congestive heart failure? No, not necessarily. So you're going to have to assess your patient's knowledge level. So that's definitely something that we'll talk about more in debriefing and whenever you all start working on your teaching plans for your patients. So but we'll work on that. That's a work in progress anyway. Energy levels. What are we going to do to help them with their energy level? What if he says, the guy said, me being a task-oriented person, I come in the morning and I'm wanting to get the bath done, the bed changed, and get him up and fluffed and puffed for breakfast. And he says he doesn't want to do that. So what am I going to do? So ask him.
Say, would you like to do it now or would you like to do it after breakfast? Give me some choices, and also usually you can limit it to 2 or 3 options. Like they can't just say yes or no, they have to pick an option.
And you also will learn that there are patients that you cannot give an option to. If you ask them, do you want to get up today? They're going to tell you no every single time. So they're like kids. Sometimes you have to just go in and say, okay, it's time to get up. So therefore, there's no option in it unless they just blatantly refuse. Most of the time, if you approach them like that, they are pretty receptive to that most of the time. Because it's like, oh, well, she didn't give me a choice.
Another thing too, a lot of times like if you just turn it around and tell them that like it's for their own benefit and tell them why, like to prevent, like especially like your elderly patients, if you throw out the word pneumonia, they freak out when they're ready for their walk. Because they don't want to be laid up in the bed for work.
Yeah. So you may have to tailor your activities. Is physical therapy coming to see them? Do we need to consider that in our plan of care? Are they having pain? Do we need to medicate them 15, 20 minutes before physical therapy comes so that they can get the most benefit out of that? If we're going to be the ones responsible for getting them up and walking, do we need to medicate them for, like, okay, in 30 minutes, I'm going to go ahead and give you some pain medicine. In 30 minutes, we're going to come back and take our daily walk or whatever. So a lot of times you have to space these activities. And for us task-oriented people, that just really messes up our day because, we like to get our little list and get things checked off and get things done. And then you have a patient that doesn't want to get their bath. It's like, really? And then they want to do it when it's in the shift change. When it's time to go home. Or that's when they need pain medicine. It's like, really? I haven't given you anything all day. And now it is 6:30 and you're needing something for pain. But it happens. So those are just things we have to deal with. Okay, so let's talk a little bit about prevention of infection with these patients. What are some things that we can do to prevent infection with these patients?
Hand washing.
Good hand washing, and that's true with everybody, right? Okay. What about avoiding crowds and limiting their visitors? We already talked a little bit about that. they're bathing them in skincare every day. Is that necessary? Should be. Yeah, should be a part of their daily routine, especially if they're immune compromised. And that is a very good time for you to assess their skin if you're doing their bath. And that is probably the most one-on-one time that you will ever have with your patients, is when you're doing their bath. Because usually it's just you and the patient, and you're doing their bath, and you're all chit-chatting. And that's when you have the most of the time, the best opportunity to talk with them and kind of figure out a little bit more about them. Okay. Cleaning their toothbrushes. How many people clean their toothbrushes?
I just get a new one.
Yeah.
Especially if you're
Clean it monthly, change it every 3
They
months.
recommend that it be cleaned twice a week.
I'll do that.
Dang.
I just don't like it.
Me too.
I do it every 3 months.
Not once a week though.
You could buy it.
Oh, yeah.
I'm gonna do the dishwasher.
Loofahs are really big.
Yeah. Especially if you're immune compromised.
Or laundry liquid.
So
The liquid bleach.
that's something to keep in
I
mind.
do bleach.
Liquid laundry bleach.
Listen up.
They rent it out.
Typically, the HCG wipes are reserved for the patients who have central lines and catheters. Now, if your patient has a central line, then yes, definitely. And it probably wouldn't be a bad idea to look at all of the time. I don't know that that's actually a policy in the institutions. So, of course, we want to avoid those salads and raw vegetables and uncooked meats, poorly cooked meats, and things like that. What are some meats that we might want to educate our patient on? Fish. How many of y'all like sushi? I love sushi. Shrimp. It's like roadworms to me. I can't stand it. So, okay, so it's a good idea to remind them about these meats. Eggs. What does eggs carry? Salmonella. What does chicken carry? Salmonella. So if they're home and they're prepared, let's say that they're going home and they're going to be able to take care of themselves, what do you want to advise them to do when they're cooking? Wash your hands, but what else? If you're handling the chicken and the eggs and all that stuff, gloves. Yeah, you want to make sure that they know to wear gloves to keep the incidence of that down, because the last thing you need is a salmonella infection.
So they can't eat sushi and fish and shrimp?
They really shouldn't if it is uncooked or undercooked. So.
But just mainly sushi, like if it's.
What about with like animals and stuff? So it's like, do they have to be careful around like the dog?
Typically, they're okay with most animals because, like dogs and cats, that's what I'm thinking of, not like pigs and things like that come in the house. But I think that they're okay with those because typically we don't pick up things from the animals, and the animals typically don't pick up things from us, generally speaking. Now, if the dog is an outside dog and he comes in and goes out, then you've got to be concerned about ticks and fleas. So that might be a different story. If they keep the dog inside all the time and bathe him once a week and do all those things, then they're probably okay, and that's a good companion for them too. I did a project on pet therapy and palliative care unit whenever I was working on a postgraduate certificate. And I was really amazed at how effective pet therapy really was for these patients. It's very soothing and very comforting to them. I wish we did more of that in the hospitals. But I will have to say that over the last year, I have seen probably 3 patients' families bring their dogs in to see them, because I go out by and the dog will be curled up on the bed and it's like, Back up. I did. It was a dog. So I think that's really nice. I think we probably need to be a little bit more receptive to that because I think that they are very, and some people are very attached to their animals.
Well, we were in clinical one weekend because I'm on the weekend, and they had a therapy dog come on the med-surg floor, and he actually went into rooms.
See, I think that's wonderful. I wish we had that at Newline. Duke does that. They have therapy dogs.
What about like the cat litter box?
We're going to talk more about that in a little bit about toxoplasmosis, which is a disease that comes from cat litter. We'll talk a little bit about that in a little while. But there again, what do you need to do? Make sure they wear gloves. Make sure they don't inhale any of the dust from the kitty litter part.
Which is really hard because when you pour kitty litter down, and like you offer like that wear a mask.
They have dust-free options.
Anything
It's really
that you can do to
expensive.
protect the patient is what you want to do. What about changing the litter? Let's see, they have the no clump litter. I don't have a cat anymore, so I've kind of lost touch with what's out there for kitty litter. Shredded newspapers, and they don't really have a lot of dust behind them.
So it comes more from the litter, not from the feces.
Well, it's the feces that's in the litter, which contaminates the litter. So,
With the cat litter, they make newspaper pellets for rabbits, so that might be an option for that. But you know about fish and like amphibians or snakes or anything like that?
oh, I don't like snakes.
That's what she knows about.
I can't have one. One will probably die of heart attack. But like I have a turtle, and they say that they carry salmonella, so I know that, but I didn't know about fish.
To my knowledge, fish don't, but they do carry bacterial infections. So you have to be very careful when you're changing their water in the aquariums and things like that, fish bowls. And I'm not sure about snakes. I don't get close enough to them to know.
I know that they say like squash them with the
Lizards, iguanas,
it says
any, in general. And I don't like iguanas either. Has anybody ever had an iguana?
My aunt
My
did.
brother
They're
did.
mean.
One of my daughters had one, and Iggy was so mean. He was so mean. He would bite you. And we tried to put him in the bathtub so he could have some, play and have, play in the water and everything. And slap you with his tail. Hey, buddy, you're on that. So he was not nice. I don't know, maybe if we didn't groom him properly whenever he was an infant or what happened, but he was not nice. He was probably my least favorite out of all of the animals that we have. My middle daughter had lots of animals.
Well, you're a trooper because my son, he ain't living in my house and having anything.
And as Iggy
dog.
grew, I said, okay, Iggy needs to find a bigger home, and this is not it. So whenever he got to be about this long, it's like, we need to find him a zoo or something, or a park or something. So we said, that's
Park.
what we did. Park. So we took him to the park. No, we didn't let him loose. We gave him.
Free
But you
range.
mean you just
If
let
I
him
had
loose
my
in the
way, I
park?
probably would have let him loose. My favorite was probably the ferret. I
Oh, they're
really
fun.
liked
They're
ferrets.
stinky, but they're fun.
Yeah. Well, we had him he was fixed and descented. You know, that kind of like, why are we doing that? He's not going to have visitors. He's not going to be having any girlfriends. So why do we need to worry about this? So they said that it would definitely help in his nature. And he was really a sweet little thing. I enjoyed him. But they're very quick too.
Are they the long?
Yeah.
We left mine out.
They look
Most
like
of the time
wiener
we
dog
litter
type
train
version
mine.
of
He just ran around the house.
You have dogs.
I have one dog. He is a Shih Tzu. He's handicapped. He has a spinal cord injury. So I was telling some of the girls about it. He does, but he hates it. So we don't use it. We haven't used it
with
in
like a dog with a
years.
wheelchair. Dog just try a little wiener dog wheelchair.
I wish he would use it because I think that would really help his cardiovascular system. And he does have some heart problems as he has gotten older. And I was telling them, I said, he sees a cardiology vet at state for his cardiac problems.
Does he really?
We go every 6 months. We're going to in about 3 weeks. He'll be due for another check. And
I'll bring all the puppies. Mine will bark too damn much.
he doesn't like it. He hates the wheelchair. He's always hated it. And I guess he feels like, well, which I don't let him outside, of course, without carrying him anyway. So I guess he feels like, why bother? Somebody will carry me for a long guy. Where I need to go. And in the house, he can go anywhere he wants to go. So,
It's adapted to.
yeah, well, he was only a year old when the accident happened. And so that's why I kind of debated about whether to keep him or let them put him down. But I thought, he's a year old. This shouldn't be much more than a stroke patient. I think I can manage this. So,
How old is he now?
oh. And I have to say, knock on wood, we have been very, very lucky so far. We had a couple of things. He chewed his tail off about 3 weeks after he had his accident.
Oh my God.
So, that was a problem. We had to go back to the vet for that. He said, I don't know what we're going to do about this. And I said, well, we've got to figure it out because he's okay otherwise. So, we amputated part of it. His little tail was only about this long now. But I mean, he chewed it down to the ligaments. I did everything I could. Nasty tasting stuff with a collar on him. We tried dressing it and everything. And he was still chewing it off. So, anyway, we put him on amitriptyline, which is an antipsychotic, for about 3 months.
Oh, wow.
It worked. Because I came up with an idea. I said, I think this is post-traumatic stress.
I was thinking that sitting here. I
There is
was like,
no
fight.
way that he could possibly feel that and do it. Not chew it off like he had chewed it down to the ligaments, So in my mind, I'm thinking he must be post-traumatic stress. So anyway, we put him on amitriptyline for 3 months, and it worked. And
Nurses with
about,
pets.
I don't know, a year and a half, 2 years ago, he had a urinary tract infection, which is common for the dogs as they get with spinal cord injuries. And then, of course, he's developed these heart problems that, of course, comes with aging.
Speaking of tails, I had a well, actually I had 2 of them. But we tried to let them go because they fell out of the nest during a big storm. And we tried to set them free again. And the morning got attacked by someone, and his tail got infected. It was like maggots in it. So we had to snip that part off and then just let it heal up. But her tail was like this long and normal.
Okay, well, let's get back to prevention of infection. Look how we got off on dogs. But anyway, okay, so we want to wash dishes. You want to make sure that their dishes are washed. If you have a dishwasher, make sure they're put in the dishwasher, or that very hot water is used to decrease the chance of bacteria. Don't drink liquids that are left out more than an hour. Don't drink contaminated water, like water from pools. And I know you're not supposed to do that, but that happens sometimes when people are in pools. They'll open their mouth, or in the lake, they get maybe contamination of giardia from the lake water. So things like that are important for you to educate your patient on. If it's been out more than an hour, it runs a higher risk of having bacteria in it. So we don't want them to drink anything that has a bacteria sitting in it. Don't reuse the dishes without washing. Paper plates. I'm not saying that everybody has to use paper plates because that can be expensive for people who live on a very fixed income. But it might be a good idea if you have a large household for this particular patient to use paper plates. Of course, don't use the litter box. We'll talk more about that here. We'll talk about some of these diagnoses, toxoplasmosis. Avoid turtles, reptiles, like we talked about, because they carry the salmonella. And of course, now think about this too. Would you think about feeding? I don't feed my dog raw meat, but some people do. They feed their kids raw meat. Would you think anything about that? About handing the dog a piece of raw hamburger meat, or a piece of a raw hot dog, or something like that? But they really shouldn't, because that's raw meat and it carry bacteria that they can pick it up. Okay, so that's something to be very mindful of. They want to monitor their vital signs every day, or at least their temperature. So with that, what do you want to do with that information? What do you patient to do. If they take their temperature every day, they need to be recording that somewhere. Because if it starts to go up, you need to know exactly when it started going up. Were there any other changes in their condition? You know, was it 98.3 yesterday, and then today it was 99.2. Then what else happened? Did they start developing a cough? Have they developed a urinary tract infection? Is there anything else going on with them that would indicate that they were developing an infection? Or have they just picked up another virus of some sort? You know, we talked yesterday about they can have 2 infections at one time. They can have, you know, like the toxoplasmosis, and then they could also have some type of a herpes virus too. So what do we want to do with this information? If the patient has a temperature, what would be the logical thing to do with it? You want to let your primary care physician know. He may opt to watch it for a day or so and just see what happens, because you know there's all this publicity about overuse of antibiotics. We don't want to do that. That's true, but these are patients that sometimes you can't really play around with either. So we want to encourage them to take their medications like they're supposed to and be very, very compliant. And it's very difficult sometimes for these patients to be compliant because of the regimen. What about gardening? Do we want them to garden? Stay out of our stay away from the garden, because the soil carries spores and all types of bacteria that can be a problem for these patients. They need to be sure to wear gloves and to wear their full mask and maybe coveralls or something like that to protect themselves as much as possible. I don't worry so much about that as I do like digging in the dirt, like when you're planting flowers or you're planting potatoes or whatever. Because then you really get into the dirt and you get your hands in the dirt, which is a bigger problem than just mowing the grass. Alright, what else can you think of? Anything else you can think of? What about if let's say that your patient wants to take a mission trip to Africa? Did you advise them to do that?
No.
And what about sexual extracurricular activities? What can we advise them to do about that? Wrap it up.
Do they have a monogamous partner? Yeah, do they have to, like, if they come in and just say that they didn't know they were infected and they had so many sexual partners, do they have, do they have to inform them, or?
They're supposed to, but does that happen? Because it's just like, they've taken this out of an assessment, but many years ago, because I've been around for a while, so I see things come and go and change and back and forth and everything over the years. But one of the things that we used to have to ask patients, were they sexually active? How personal is that? Do I need to know that to take care of that patient? Probably not. If they're sedated and on a ventilator, I don't care if they're sexually active. I mean, it's kind of a moot point at that point. That's not a priority for me. So, yes.
I don't know if you said, because I can't really hear you up here, but in the book it said the patient can take the patient's significant other, you know what I mean, can take a prophylaxis.
There is a medication, it's a pill. I can't remember what the name of it is, but there is a pill that they can take once a day. And then, of course, if they use all of the other precautions as far as protecting themselves during sexual activity, or maybe choosing other ways to be sexually intimate.
They said that they should wear gloves too.
Yeah.
Yeah.
Okay, so now let's talk a little bit about some nursing diagnoses for these patients. What are some diagnoses that we can come up with for these patients? What's your first and foremost? Okay. Infection. Right. Now, sometimes these patients may be anemic too, and if they have respiratory issues, what kind of a problem is that going to bring to mind?
Oxygenation and perfusion.
Oxygenation, inadequate oxygenation. I'm just going to put decreased O2, but you know what that means, right? Okay. A lot of times these patients will have what's called the cytomegalovirus, and that's very common with transplant patients too. And that's a lot of the times they are on steroids long term and anti-rejection medications most of their life, the rest of their life, to prohibit the rejection. I'm sorry. CMV. But you don't need to know that. I mean, not that's just something that I told you that you particularly see with transplant patients. What about pain? Do you think pain is going to be a big problem with these patients?
Yes.
How are we going to manage their pain? If they're in an acute phase, what are we going to do?
Narcotics.
And we may want to use IV medications. And then we gradually want to get them on PO medications because they can't go home on IV medications, right? So what are some things that we're going to assess them for whenever we're medicating them? Sedation.
Respiratory.
Okay. Are they alert and oriented, or are they drowsy? What about their oxygen saturation?
Respiratory status in general.
We'll monitor their SAO2 to see, with 88, we don't want to give her 2 milligrams of morphine. We've got to figure out something else for them with her. Okay. And in a situation like that, is oxygen going to help this patient? Probably not. If their SAO2 is down because of sedation, I won't say over-sedation, but because of sedation, because you don't have the drive there to pull the oxygen in. So, yeah. Yeah. What would we want our outcome to be, possibly, with a patient and we're monitoring their pain and we are treating their pain? What type of outcome would we want with these patients? Okay. So we want to decrease level. Okay. And you want to find out what's tolerable to that patient. Some patients have a 0-degree tolerance, and some people are okay with a 3. I can manage with a 3. So that's important to know, because in those patients, you will know that you're never going to get to a 0, so don't expect it. But that's important to know when you're treating them. All right. What about nutrition? What's our goal? Okay. Maintain their weight. What about skin integrity? Because remember we talked yesterday about the protein in albumin and how you lose it and it leaks out into the third space, and then you have generalized edema in the hands, arms, feet, legs, and then they run higher risk of skin breakdown. Okay. So, we want to encourage intake. Okay, small frequent meals might be a possibility. And sometimes you're gonna run into patients that they don't eat very well at all. And if they don't, sometimes we just have to give them whatever they want. If they want pudding 3 times a week, because they're not eating anything otherwise. So that, something is better than nothing. So just remember endeavor to be a little flexible with that, and it may be that they like foods from home better than they like in the hospital, so you may want to have their families bring foods into them. They may want, I don't know, chicken or whatever, spaghetti that, is from home rather than what's in the hospital. So, and that's okay. Okay, what about, what other things would we want to use to assess our nutritional status? We want to maintain their weight. What else would we look at? Okay, energy. We want to maintain adequate energy level, right? Okay. What type of things would we assess when we're looking at their nutritional status? When you're looking at your patient and you're trying to assess them, what are some things that comes to mind that you need to look at? Okay, their appearance. And we're going to look at their mucous membranes, right? Are they pink? Are they pale? Are they moist? Are they dry? I'm just going to have membranes here. Urine output may be something else that we need to monitor in these patients, particularly if we're giving them fluid boluses. Let's say that they're hypotensive and you're trying to get their blood pressure up to 100, then you really need to monitor their output closely because you want to make sure that you're getting out part of what you put in because you don't want to put them in overload because they're already very fragile. Okay. Skin turgor is something else we would look at, right? We may need to do a calorie count on these patients. Sometimes dietary will have us do a 24-hour calorie count or a 3-day calorie count on patients to see how much they're actually taking in, to see if they can change it up, to get them to take in more protein and things that's going to be more beneficial to them as far as the healing process. The problem with these patients is that, especially if they're pretty far along, it's very difficult to keep up with their caloric intake. Things are usually very well tolerated if you have the right formula. There's tons of different formulas out there. But if they're having a problem with diarrhea and they're not tolerating it, or complaining of abdominal pain, then you may need to look at the formula that they're being given. You may need to try to find something that might be a little bit more suited for them. What would be our problems with IV supplements? Let's say that we wanted to, maybe they had an ileus and their gut wasn't working, so we wanted to give them some TPN. What kind of problems are we going to encounter with that particular form of nutrition? Now that's going to be in a big line, but you could have infiltration. Your blood sugar is going to be affected. They're also going to have an increased risk of infection at that site because you have so much more dextrose in those IV fluids than you do in regular IV fluids. It's a lot more concentrated, so that's why you have to give it in a central line, and that's why you need to watch them closely for infection at the site because it's going to be higher because of all the dextrose. But the dextrose helps increase the intake, the calorie intake too, so that it helps nourish the cells. So it's kind of you try to do one thing and then something else falls apart. Okay, what's another one that we might have with these patients? Confusion. They have the dementia complex, which can result from HIV and AIDS. So let's say, what are we going to do for that? And I know, let me tell you this, in the real world, they tell you to reorient people, and that's okay if you can do that, but there are some patients that you just cannot reorient. They get very agitated and very restless, so do not create any work for yourself just because you want them to know where they are. I mean, that's nice, but it doesn't always work.
Correct, my grandmother, she gets agitated. You're a tackler.
So sometimes you just have to let things like that go.
sometimes we even with the meeting, it's just because they have someone with them. The nursing staff can't do that, so I can get it. ESA or something.
Right. So companionship. And when you think about it, you think about the patient. They're taken out of their normal environment. They're given medicines maybe that they're not normally given. They're sick. Maybe they have developed an infection somewhere along the way. So, and sleep deprivation, because how many times are we in this bedroom? 24/7. So they don't get a lot of uninterrupted sleep. And if they're in a critical care area, sometimes they can't tell the difference between day and night because things are going on all the time. So when you compile all of those things, and if they're older, it's all just like a snowball effect. So they may be more likely to be just confused because of the environment that they're in too. Is there anything we can do about that? There are some little things we can do about that. We can space out our activities.
I always make sure the blinds are open during the day and closed at night, because a lot of times, some people will try to, turn all the lights off so they can sleep all day just so they don't bother you. But a lot of times you open the blinds, like you see it's daylight out, so they kind of help with the stuff.
So we want to try to orient them as much as we can with the environment. And, a lot of the activity activities go on at night, they go on during the day in certain areas, so, they're not going to be able to use that as a gauge, whether it's day or not. So, let's see, we already talked a little bit about impaired skin integrity. We can definitely address that with nutrition and with terping and getting them up as soon as possible. And do you remember what one of the medications is that can be used for an appetite stimulant if they don't have an appetite?
Rimron?
Megase. Megase works really well for them if they'll take it. Now sometimes they won't take it because they don't feel like it doesn't need it. So if you get them to take it, Megase works really well to stimulate their appetite to get them to eat a little bit better. Okay, so let's look at one let's do the decreased self-esteem. What are we going to do about that?
Don't make them feel isolated.
Okay. We're going to decrease isolation. Social isolation.
Involve other disciplines such as your social worker or your some type of
other. What else can we do? We may want to assess the patient to find out why they have low esteem. Is it the fact that they're not able to work? Maybe they're not the primary breadwinner in their family anymore. What's going on that has made them feel this way? And is there anything that we can do? Can we pull in some extra resources to help BSC community resources? Support groups are good. We talked a little bit about that yesterday. It's good for the patient and it's good for the family too. So, what other things are we going to do to try to take care of these patients? We're going to make sure they take their medicines like they're supposed to. We're going to make sure that you minimize the chance of any infections that they can possibly get in the hospital. So, that's the main thing with these patients. Now, I'm going to give you a list of 6 patients, and I want you to think about this before you answer. You have come into work and you're working on an HIV unit, and these 6 patients, and I want you to think about how you would feel if you got that patient, these patients for your assignment, and how you would prioritize which one you would see first. Y'all work on prioritization? Y'all work on that? Y'all point to right now. Okay, so we have heterosexual female. And she is condition in his right leg. Okay. And he got his from blood transfusions. So just take a couple of minutes to look at those, and we'll talk about how you prioritize them, and what your position and judgment would be on each of these actions. All HIV positive. Okay, now this kind of puts you into a situation of critical thinkings, which is one of the things that with second level we really start spending a lot of time on, getting you to critically think about things and apply what you know. Because you're kind of past the knowledge level at this point, because you've learned a lot of what you need to know, and now it's basically applying it. On the other hand, nursing is an endless education project. You never stop learning or taking education classes as long as you learn. This is just the tip of the iceberg here. Very tip. So, okay. So let's look at the first one, heterosexual female. These are all AIDS patients. Okay. What else might we want to know about her?
Relationship.
Okay. Yeah. Relationship. And just be prepared when you start delving into these situations. Just be prepared for your divorce. So, okay. What about the homosexual male? What else do we need to know about him? How long they have? They're sexual. Okay. And another thing that we're going to want to know about all of these is how long they've been positive, because that'll help us gauge where they are in the disease process. What about this newborn baby girl? And how is she? Is she okay right now? Does she have any signs and symptoms of complications? Does she have any infections going on? Those are all things that we're going to want to add to. What about the 40-year-old mom with 3 teens and she's single? Okay, support system. Does she have a support system? Is she able to work? What type of financial aid does she have to support these 3 teens? Are these 3 teens on board, or are they like 13, 14, 15? They're too young to really grasp what's going on with their mom. Where is she in her disease process? What about the 30-year-old homeless drug user?
What type of drugs?
Okay. Type?
Like, is it IV or is it? Yeah.
And is he homeless because he chooses to be, or because he really doesn't have any other resources, or has he burned all the bridges that he had? Because sometimes these people burn the bridges and their families are like, I'm done with you. You know? Those things that are important to know, because if he doesn't have a support system, then we're going to have to figure out what to do with him when he gets ready to go home. If he's not able to go home or go back out to the street, I hate just trying to go to the streets, but it happens sometimes. Again, what are around our little 17-year-old hemophiliac has got an infection in his right leg and he got him on blood transfusions? What else do we want to know about him?
How often do they get transfusions?
Okay. How many transfusions? What else?
Treatment for the infection that's
Severity of the infection. What else? Now he's hemophiliac, so that's probably one of the reasons that he's getting blood transfusions.
What's he doing to be careful not to bleed?
Okay, is he using the safety razors? Is he using electric razors? Is he, putting things that can injure himself? Okay. And, while this drug user, he's probably positive because of choices that he made. This 17-year-old teen is probably not, because he's a hemophiliac. He didn't choose to be that way. That's just makeup came from. Okay. So now let's look at how would you categorize these patients. Which one would you want to see first? You like that? What?
Yeah.
Why?
F.
This one? You want to see this one first? Why? He has an active infection. Okay. All right. Now, who would you want to see second? More girl. More girl. Okay. Why? Have a weaker leadership. She's compromised. She may have a weaker leadership system. We want to make sure her vital signs are okay. Okay. What about number 3?
The homeless man. Yeah. He needs access to clean environment.
Which?
The homeless.
Three.
Homeless.
E.
They don't have much health care, so they may not be use that. So maybe that's how they can
Help
get-
provide him resources.
So nobody else is really looking after them.
This one here. So maybe she's been. I can see where this one might be very time consuming. Because she's got dissertations and what she really wanted that she had, and then she's probably going to have a permit eventually. So all of those things seem pretty good. Okay, how about number 4?
the 30-year-old homeless drug user.
Right? And that's because of his potential lack of resources, right? Okay, what about number 5? B. B? Okay. Why don't we give him B?
Just like the 25-year-old should have the best immune system depending on how advanced she is. That he has more readily
But didn't the book say that women have less care?
heterosexual females can get prostitutes. Yeah, but it said that you can get it universally with that.
That, okay, let's say that she is. Should there make any difference in her in the care, or would we place her in the hierarchy of things? Really shouldn't.
Didn't
It's very hard to be non-judgmental, especially sometimes when the patients are very ugly or not very nice. It's hard to be non-judgmental.
if the book said that females tend to get less care or worse care if they get it, shouldn't we try and move her up the line just to maybe prevent that research statistic?
Why do you think that is? We talked about this, Jessica.
Because she's a
caregiver.
caregiver. She's the one who normally does the caregiving.
So think about yourself. How many times you don't feel well, but you don't take issue with it because you've got kids that get to all practice on dance. All of these things, and you just keep going.
But she probably did get some more care. At 25 medications.
Okay, so your position is that we should probably move her to maybe here and prioritize her a little higher.
It also says that, like, depending on the sexual partner, sorry, I was looking at my watch. Depending on how many sexual partners she has, they're less likely to, like, it longer
that's a thought. So do you think we should switch these two? What do you think?
I think it could be either or.
I mean, the girl would have higher
Yeah.
priority because she's younger.
Some like
She has more
D&E
chance of getting
easily be
pregnant and
switched.
transmitting it to another child or
No. Okay, well, and she's heterosexual. So we really don't know, is she married or does she have a lot of extracurricular activity or, you know, what's going on?
Her preferred proclivities. His wife could get pregnant.
We're not trying to prevent, right now we're doing care, we're not trying to prevent them going out and pregnant.
So we also got to teach. And then you've got to, like you said, you've got to include your teaching in all of this too, with each of these patients.
I think it's hard to do it after at the team because you don't know what the condition 6, 5, 3, 4.
Okay. So what are some other things that you might want to know about their physical condition?
Like what symptoms are they exhibiting?
Are they having shortness of breath? Do they have a fever? Are their vitals unstable? See, all of these things, when you start getting reported, giving report to your nurses, these are things that's going to start coming to your mind that you're going to need to ask. And, you know, what else do I need to say to take care of this patient? That makes sense. Why don't y'all take a 15-minute break and